Hi everyone, I am Dr. Syed Nurullah. I am an ENT surgeon working at Uday Omni Hospitals. So we are working here every day from Monday to Saturday, morning 9 a.m. to 3 p.m. Today the topic of discussion, what we have is nose block. Now what is nose block? We see every other day whenever there's a season change, whenever there's a sudden change of weather, you change your environment, you change the habitat, and then suddenly you start suffering nose block. Now you might be thinking nose is a natural thing, everyone has got a nose, then why only suffering is from only from me? If you're thinking that way, you're wrong. 90% of the people suffer these issues of nose block. Now, why does it happen? Nose block is commonly related to the anatomy of the nose. Now we have a septum inside the nose, there's a bone inside of the nose, and inside we have kind of air bubbles that are called turbinates. Now, whenever there's a change of weather, change of your house environment, or there's a quite a shady environment near your house which is very like having all the trees around, so you'll be having there's a growth of the turbinates that causes the nose to be blocked. Now this nose block is temporary. Now imagine you are having this temporary nose block, and especially this nose block is lasting for 3 to 4 days, then it is nothing to worry much, that will be going off automatically on its own. Now when should you be worried about the nose block? When it happens throughout the year, like it is not stopping in a month. Every two months you're getting it, the nose block, like whether you're getting the exposure or you're not getting the exposure, it is at that time that you should be worried, and you should get it checked up with the ENT surgeon around. Yeah, now what happens is you're having this nose block. So what we generally see is people try to rub the nose, people try to put the fingers around, people try to muddle it up and make it even worse. Now imagine what will happen. There's something called as fingernail trauma. This fingernail trauma will cause the nose to start bleeding, which will lead to epistaxis. And then this nose block will cause frequent drying of the nose, and then frequent drying, you'll again try to have itching of the nose, and you'll try to remove whatever is there inside the nose, and that will again cause bleeding. So basically nose block is leading for you to cause one of the causes of bleeding. So one cause is bleeding, one of the major complication is bleeding. Second thing is there is something called as Schluter's neuralgia. This, whenever there's a nose block and you have a deviated nasal septum, there's a septum that is totally deviated, that is impinging on your turbinates, this will cause you a lot of headache, especially when you're trying to move it in the air or under the fan. You'll have a lot of headache and then bleeding simultaneously. So these are the two major complications whatever we see in case of deviated nasal septum with nose block, and that is, first thing is bleeding, second thing is headache. Now other common things that we see is whenever it is untreated for a longer duration, but such patients complain of cheek pain, headache, frontal side, office headache. Such patients will land up in cases of sinusitis. So it's better you get it treated at the earliest. Now there are few things like you can help with the nose block. What we generally see, what in an old age group, is better it is go for steam inhalation. Taking steam in and out with the help of something like Vicks or anything that is there in the home natural remedies, you can, with that you can help your nose block temporarily. But if it is happening regularly throughout the year, then that is not going to help you much. So what we can do is you can come to us at Uday Omni Hospital. I am available morning 9 to 3. We'll evaluate you through endoscopy. We'll put an endoscope inside your nose and we'll completely check what is the situation of your turbinates, what is the situation of your septum, and then based on that evaluation we'll take the further course of action. Now what is basically everyone, whatever who comes to the OP, they generally tell to us that we were told that we have sinus problem. But what is the sinus problem? But if we see that very in depth, patient will have basically nose block, but it is not sinus problem. What is sinusitis? Sinusitis is you are getting up in the morning, you have very bad headache, you're trying to bend down, try to do some work, you're having bad cheek pain, you're having bad ear aches, you're having bad nose blocks. Such things is basically sinusitis. So how do you evaluate a case of sinusitis? Sinusitis is, first, as I told you, we'll evaluate you through endoscopy. After putting an endoscope, if you find almost everything is fine, then we get a CT scan done, and then we rule out whether the sinusitis is there or it's not there. What are the major causes of sinusitis? Now, as we live in an environment which is almost adulterated for everything, so it's better you get it evaluated for allergy. allergy is the basic reason for almost all causes of sinusitis. Right? Now, how do we treat this case of nasal block? Nasal blocks are basically, as I told you, home remedies that help a lot way. Is first thing is steam inhalation does help a lot. And off lately, what I'm seeing is all the practitioners around, they have a fancy of writing nasal decongestant nasal drops, which I will tell you it is not to be taken over the counter. You go to a pharmacy, you're having nose block, अरे भाई वो दे देना, वो drop दे देना. It is wrong. You should not put a nasal drop until and unless it is prescribed by an ENT. The reason is pretty obvious, because if you are an hypertensive patient, your hypertension will get worsened up because of that nasal drops. So you should know which nasal drops you are taking. First and foremost thing. Second thing is, imagine if the cause of your nose block is because of allergic rhinitis. You are just taking the nasal drops. I have seen a lot of cases which have come for months in duration, 5 to 6 months in duration, who have been taking just the nasal drops, decongestant nasal drops, and they have been not been cured. There's something called as rhinitis medicamentosa, which will, if you continuously put the nasal drops in the nose, that will worsen the condition that is there in the nose. So a better option here is, you please see what is there, the etiology of the nose block. If it is deviated nasal septum, please try to get it evaluated properly with an ENT surgeon and get it operated. If the cause is allergic rhinitis, see that you're properly taking the medications and you're avoiding the allergens. If the cause is anything anatomical, please get it evaluated completely. If the cause is just temporary, a steam is more than sufficient, rather than taking any random ear drops, random nasal drops. See, what we see in sinus issues more often is patients taking longer duration of antibiotics, which in my perspective, is totally wrong. If you are suffering, only then taking the medication is going to be helpful. A duration for 5 to 7 days is more than sufficient to help you treat sinusitis. Now, we also, as I told you, if the cause is allergic rhinitis, we even prescribe steroid nasal sprays. The steroid nasal spray helps you, and it helps you in a longer duration, and it helps you in a lot way better when compared to the other medications that are being prescribed over the counter. So just going to a pharmacy, saying that you have a headache, saying that you have a nose block, saying that you have sinus issues, taking medications for 1 or 2 days, like imagine you're taking antibiotic just for 1 or 2 days because the pharmacist does not prescribe you more than that. You will take for 2 days. But what we are seeing of lately is, in the management of sinusitis, we are seeing a lot of resistant cases. We are not able to give them any kind of antibiotic because they have taken almost every antibiotic available in the market. So that is totally wrong, I believe. If you come over here, we'll try to evaluate you with the help of culture sensitivity if it is chronic. If it is acute, then we'll obviously help you with the similar antibiotics in a smaller duration. And in that way, we can get, if still it is not getting treated, then we have something called as a surgery called as endoscopically. What we do is functional endoscopic sinus surgery, FES. Basically, we are trying to improve the function of the sinus. That's why it is called functional endoscopic sinus surgery. So we improve the function of the sinuses by opening it up with the help of endoscope. You will not even be able to visualize whether the surgery has been done or not done. So this is the newer technique what we have, rather than the older days which we have something called as a Caldwell look operation, where we had to open up completely, exenteration was happening, which we are not doing nowadays. We are trying to do with the help of endoscope. So that is going to help you a lot and going to relieve you of your sinus functions. Thank you.